Welcome, everybody, to the Hikigai Studio Conversations, where we bring together leaders shaping the intersection of technology, business, and human purpose. At Hikigai, our mission is to amplify the visionary voices, also innovators who are not just building companies, but they're re-emerging how fundamental human needs like health are met. And our guests today are the rare leaders, I must say, who understand the true impact of requirements for moving beyond the bedside and to reshape the entire system. They are the physicians, like our guest today with us, who are transitioning from treating one patient at a time to building an intelligent system that can impact millions. We seek out those who blend clinical empathy with technological intelligence, and they create a meaningful and a scalable solution for health. That brings me to our wonderful guest today. Our title today, first of all, is Mind, Machine, and Medicine. So apt for my guest today, exploring the impact of AI in healthcare. And as a psychiatrist, Dr. Patel, you focused on the mind, the most complex system there is ever. The great irony and power of your work is that you are now using the machine, as which I should say is artificial intelligence, to better understand, treat, and scale that care. It truly captures the central tension and promise of this field. And it's tremendous pleasure to welcome you, Dr. Bhargav Patel, as a physician innovator who stands at a unique intersection of medicine, technology, and business. He's a practicing child and adolescent psychiatrist, specializing in trauma and resilience, and also a former chief medical officer and founding medical director of AI clinical support platform Sully AI. And he's actively reshaping the future of healthcare. First, Dr. Patel, congratulations. Is absolutely in order, not only for your recent top 100 in health and wellness award, but also for achieving the significant professional milestone of board certification in psychiatry, which is a testament to your dedication to excellent clinical excellence. Congratulations.
Thank you so much. And thank you for having me.
Absolutely. My pleasure. That brings us right away to, deep dive into our conversation for today. We're talking about the bridge between mind and machine today, right? But I also want to start with a moment that bridges your clinical past and your tech driven future. Do you recall one specific patient interaction or any clinical challenge that was so complex and repetitive or time intensive that it made you think, there has to be a technological solution for this? AI could fundamentally change this moment. Has there been one for you?
I think that's all of them. In healthcare, everything is a challenge.
You bet, you bet. But has there been an instance where you really thought, this could be totally helpful if I had an AI tool to kind of give me that guidance so I could use my cognitive, load to something which is a little bit more powerful?
Absolutely. I think one thing is when you're dealing with a complex patient, for example, and you're looking through their chart and the records are all over the place and there's hundreds of notes over so many years, there's no feasible way any human can review all of that. And I think that's one of the places I think definitely would be incredibly useful if an AI could go through all that data and summarize what's been going on with a level of sophistication. You could save so much time. Obviously, AI scribes, all of these things, like there's so many uses for AI all throughout healthcare. And I think we're going to start to see many of them over the next decade.
Excellent. Yes. And that kind of segues, from the point of just acquiring the knowledge versus using the intelligence of what you've really been qualified to. So that certainly, summates a very important aspect of how all that information that you need, and it's so much information that you need to gather to be able to do your best in that situation. So I've kind of split up our questions to different titles, if we may, and that would kind of just make it easier for us to also put our thoughts together. So my first one, I would call it bridging fields, right? You're successfully bridged three different fields, and very impressive, actually: medicine, business, and technology. And what really inspired you to move beyond just being a clinician to founding and leading health tech ventures like Soli AI, and then my peak. So what's that, the combination? How did you bring that marriage together?
I think I've always been someone that had many different interests, and people tell you to focus on one thing, and I was just never able to do that. So I've always explored different areas. I'm like, if I enjoy doing it, I'll make the time to do it. And so really, I like to both dive deep into things and spread out across things. So especially with medicine and technology, I think those are two areas I'm really passionate about. Um, and with the business, it just becomes like a third. It's like a foundational thing that fuels them both. It's not specifically that I'm interested in business per se, but I'm interested in medicine and technology, and business kind of runs both of those fields. So I
Absolutely.
had to be interested in that by proxy.
Yeah, well, and it's definitely going to be effective for you because you're soon going to start your own practice, and that certainly kind of fits in very well. And needless to say, technology is almost like a default today for us to include in the medical field. Okay, so the AI in mental health, call that being opportunities and risks. As a psychiatrist trained in trauma resilience and neurodevelopment, very very high level topic. Some of this would just go over my head, but I'll try and stay sane there. How do you see AI playing a role in mental health care, because that's definitely a very crucial problem to solve? And what are some of the biggest opportunities, and where do you see the real risk?
I think there's a lot of popular things today. For example, in 2025, the number one use for chatbots was actually for therapy and loneliness and emotional support, which wasn't the case in 2024. It was top 10, but it skyrocketed to number one. So that one speaks to the modern state of the world, that the number one thing people are using them for is for emotional support and therapy, and because they're feeling lonely. But that brings with it a lot of pros and cons. I think it's great that they can be available 24/7. I think it's great that they're helping people feel some sort of like support and friendship. But at the same time, there's dangers of attachment to technology. There's also dangers to the fact that some horrific cases have happened where the chatbots gave people advice on how to kill themselves or things in that regard, which is it's tragic. And there's challenges, I think, with controlling, putting guardrails, appropriate guardrails on these technologies that they're not essentially practicing like they're clinicians, for example, when these chatbots are giving advice. So I think there is major wonderful uses for like AI technologies in terms of therapy, but as a support, a therapist cannot see someone 24/7 every day of the week. It could be a wonderful tool with the appropriate guardrails to provide people support when they need it while being maybe overseen by their therapist. And, because a challenge you run into with AI chatbots for therapy is they're sycophants. So they just agree with whatever you say. They echo back whatever you want to hear, which is not what therapy is. You don't learn things just by someone telling you exactly what you want to hear. So that's a challenge. But I think there's other areas of opportunities that are just much more precise. It'll be useful in research and developing new medications, not just for mental health and psychiatry, but for every field of medicine. It will advance drug development. It will advance research. There's also tools like, speech pattern analysis. You can identify people at high risk of suicide using analysis of speech patterns and tone and all of these things. So there's a lot of opportunities that exist for implementing AI in mental health care. And I think they'll start to be implemented more and more over the years.
That's fantastic. I think you've summarized it so beautifully in terms of, bringing out the risk and the opportunities. And now we need to bring out a balance between that, like you were talking about with the guardrails. So that really is the model collapse. Now, if there is a model collapse, or I would like your opinion to see on something that's not often discussed, right? It's the model collapse. What happens in that situation? I mean, how do you react to that, or how do you solve this problem? Because this is something which people are not talking about, even though the systems are all readily available. As you rightly said, the governance for some of these are not well written. And how do you approach this?
Yeah. So especially with model collapse. So the challenge is this, right? What for the audience that may not know what it is, I'll just define it. Model
Sure.
collapse is when an AI model, like ChatGPT, a Claude, Gemini trains on data that is predominantly AI generated. So before, obviously, all of the data was human generated. So it had all the quirks and diversity and complexity of humanity. But now we're getting some data that even maybe up to 50% of the data, new articles, data, everything being produced is using AI. Same with code and other things. The problem is when AI, now future models, because we're running out of human created data, when
Mhm.
future models train on AI created data, it's like AI training on AI. It's like, for example, it's like taking a picture of a picture and then repeatedly taking a picture of a picture or a photocopy of a photocopy. You're going to have deterioration in quality because it will no longer give diverse outputs, and it ruins the quality and the capabilities of the models. And that's something we're going to face or potentially face. It requires a lot of steps to prevent it from happening, and just a lot more mindfulness in how we develop these things to make them prevent it from happening. But if that happens, right, these models will not continue getting better and better. They'll actually start to get worse because of their training on their own data, which is not very useful. The only reason they're so good right now is because they trained on the complexity of human data.
Excellent, excellent. So yeah, there has to be some set point where you need to kind of stop generating more AI generated material, where it has to be optimized and it's more human generated material, and bring that optimization into a balance, right? Okay, very good. So that brings us also to a follow up question. Let's say that a psychiatrist, they're going to be at a disadvantage because of the model collapse. How do how do you resolve that problem? I know you did say that you have to make sure that you put the guardrails and you make sure that it's tested more with real data that is human generated data. But in specifically in the psychiatry, how would you address this problem?
So that would be relevant if it was like a psychiatry specific model, but a lot of the technologies built today are essentially wrappers around these larger LLMs. So your Chat GPTs, your Claudes, your Geminis. So in terms of those, it would be up to the providers making those, the companies making those, to be careful in their data curation, making sure there's an appropriate balance of human generated content and high quality data in there. Because if you put garbage in, you get garbage out of these models. So there's an importance in the type of data used, especially with medical specific models. So the way to avoid that is quality data and quality selection of data. So if model collapse happens to these core foundation models that a lot of these things are built on, it will affect the quality of everything built on top of it. So I think the responsibility for that first and foremost will lie on the foundation models. And so they have to be careful with that.
Okay, so would it be right if I say that a doctor on board, or a medical advisor on board, is one of the most essential things in whatever models that's being built, whether it's being built for a specialty cardiology or psychiatry or whatever it be? It has to be definitely addressed to who the end user is to make sure that it's done right.
Yeah, I mean, for any health tech companies that are focusing on healthcare, it would make no sense to not have experts for what you're trying to build for, because you'll build something for the wrong group. You'll build something that maybe sounds interesting to you, but no one will use because it doesn't understand their pain points. So I think any company that is building in health tech should have the end users as part of an advisory board or actively involved in the development, not just as part of an advisory board, but actively involved in leading the development of products.
Okay, well, that brings us to the next topic that I would like to discuss about AI literacy in medicine. It's interesting. We just spoke to another pioneer who's doing a lot of work in the AI and medical medicine space, and he was talking about there being more astronauts in the United States than there are physicians who are actually trained in AI, or who are comfortable with knowing how you can expand the how you can expand your practice in terms of the AI features being available. So Should AI literacy be a mandatory part of medical school curriculum from what your experience is? And if so, what should that actually look like for in the practice?
That must be Dr. Chang. I've heard him say that before. There's more astronauts than there are clinicians who are literate in both technology and medicine, or
That's right.
data science and medicine, which is crazy. And we need more of that, especially if we're going to build healthcare AI for the future. I think in terms of literacy for AI, it's very important in general and should be involved in medical schools. I think the graduate medical education committees have also started to include it as part of like residency training or as an objective. It hasn't been necessarily fully incorporated yet. But I think medical schools are actively involved in the process of trying to at least teach basic literacy of AI. Some are incorporating it far more than others. But I think it'll be very important because we will be using these tools more and more over the long run, whether it's like AI co-pilots, AI scribes. And these tools, we need to know what the risks and benefits are, like any other tool. Just like when we give a patient a medication, we talk through the risks, the benefits, the side effects, interactions, all of these things. It's the same thing with AI tools. I think we need to be aware of those things. And the only way our future doctors and clinicians are going to be aware of them is by learning about it in school, which, of course, there will be some degree of learning about it on your own. But I think some more structured education would be crucial for that.
Okay, fantastic. Okay, so that's leading us to a little bit more a deep dive about digital twins, right? You're talking about simulation and digital twins. You've recently suggested that simulation based AI tools can help medical students learn without requiring real patients. Do you feel they make a significant difference?
So there's two parts to that. So there's simulation based tools, and then there's like digital twins, which could also be used as part of simulations.
Mhm.
Now, true digital twins as a concept is it's a virtualized form of something physical. It doesn't just apply to healthcare. There's like digital twins of like buildings. There's digital twins. So it's creating a virtualized representation of a physical thing. But in healthcare, a digital twin could be, for example, a virtualized representation of a body that you could practice surgery on, and like a specific body. Now, so these things don't fully exist today, but there is potential for them to exist in the future. So just imagine a surgeon needs to perform surgery on somebody specific, and they have every person's anatomy is unique. When a surgeon goes in to perform a surgery, two bodies never look the same. But if we had true digital twins, they could even create an exact simulation of that person's body and anatomy and practice on that digital twin to know exactly how to cut out the tumor, for example, or the appendix, or various things. So there could be a fully virtualized digital twin of a person. Cancer treatments, if you create a virtualized digital twin, you could, if we got to that point in science and had all that data, we could test out cancer drugs on this virtual digital twin and see what effect they'd have, and then use that to make decisions on what we'd actually use on the physical person. So that is like the ideal end scenario of digital twins. That would require very advanced science. That would require like technology that would basically give that one for one data all the way maybe down to the cellular level. So that's the ultimate end vision, which would be revolutionary for medicine. But in terms of even in a much more rudimentary form, it could certainly be used in simulation based education for medical students. There's people out there trying to build tools for simulation for medical education, because you can't truly simulate everything in the clinic, or in early years when med students are learning the basics. We actually hire what are called standardized patients, which are actors who pretend to have conditions, and the med students interview them to practice. But we could certainly create virtual forms of that, which would even be more sophisticated and complex.
Interesting. And specifically in psychiatry, this is like, out of the context, but I still am very intrigued by this whole digital twin because it's so much involved with the mind, right? Is that simulation a little bit more easier in that sense to create the digital twin versus others? Or do you think that's the most complicated in all sense?
So, I mean, it would be easiest to create it for systems we understand the most. So, psychiatry would probably be the most complex because you'd have to create a digital twin of the brain. And if we could really simulate everything going on in the brain, we would have created artificial superintelligence by
Yes.
now, because that's the ultimate goal, right? For example, if we could truly mimic that, which is one of the schools of philosophy and artificial intelligence, the idea that if you can replicate all of the connections of the brain
Right.
one by one, you could theoretically create artificial superintelligence, or at least artificial general intelligence, which would then lead to that. So that would probably be the most complex digital twin to create in the fullest sense with the brain and psychiatry.
Very interesting. Okay. Now we're bringing some, rudimental tools that we're actually using right now. AI Scribe is out and about, and it's being talked about a lot today, right? There is
Yeah.
a great deal of discussion about AI Scribes, and you yourself have done like very thorough reviews of the New England Journal article that came out recently, and so many more that have been talking about the actual value of AI Scribe. Do you use AI Scribe personally? And how is it as an experience when you compare it to a physical scriber? And do you have some advice on some of the tools that needs to be, we need to focus on when we are providing an AI scribe to a physician and to further innovate and improve it? What are some of the things that you would suggest?
Yeah, I think AI scribes are great tools. They will not fix all that ails healthcare, but they will be a part of it, right? Writing notes is a huge burden for physicians. It's one of the number one causes of burnout today, documentation. So AI scribes have addressed one of the biggest causes of burnout, and they don't fix everything, right? The AI scribe listens to the encounter like a human scribe used to, and it will transcribe the encounter. You still have to read the notes. Based on the studies, it really varies. A lot of the AI scribe companies have, on average, said saves about 2 hours a day. Most of the published studies show it saves probably from a few minutes to maybe an hour a day. I think one of the recent ones I think showed between a few minutes and 22 minutes. But even the ones that didn't show much time saving did show a significant reduction in burnout and cognitive load. Because even if it takes you the same amount of time, the scribe is going in. One, you can just pay attention to the patient. Like, you can have that human connection back in healthcare, and focus on the patient rather than sitting at your computer trying to document your note because you're worried about having to write 30 notes in the evening. So it's brought that sense of humanity back into care. And I think that will be a great thing as these get even better. Second, it does reduce the cognitive load, because even if it's not perfect and you have to take some time editing it, it got something there. It got the foundation of it, and then you can make edits. But it's like it's doing 80 to 90% of the work. And then, so I think those are two big things, but there's plenty of other areas to address, right? Like pre-charting or like chart review, patient messages. We spend a lot of time responding to patient portal messages and those kinds of things. And an AI script, like an AI tool that would help with that, would be very useful as well. I think there are companies that have built that. So there's so many areas where AI will be useful. But AI scribes, I think, was the lowest hanging fruit, and many companies went after that. I think almost $1 billion has been invested into the AI scribe market at this point. So it's a low hanging fruit that a lot of companies have worked on, and I think it's helped a lot of physicians.
Yeah, well, that brings us to thinking about what's in store for us for the next 5 years, right? You, as a psychiatrist who's actually got a great blend of business and technology in place, and with you starting your own practice, where do you see AI playing a significant role in healthcare in general and in psychiatry, if I may say so, because that's your specialty? And you, as a person practicing it so intensely, where do you see yourself as some of the goals that you see as futuristic for yourself to to bring that perfect blend of psychiatry and AI in place?
So I love that question. I'm actually currently writing a book on the future of AI in healthcare. Will probably be published at the end of next year. And I think there will be a lot of changes coming over the next 5 years, even with the current technology today, even if it didn't progress, which it will, but there will still be significant change. I think within the next 5 years, every hospital system, clinic, et cetera, will use AI scribes. but not just AI scribes, they'll have AI tools that are AI co-pilots, essentially working with enhancing decision support, making clinical decisions. I think that will make care safer. It will, across the board, it will help reduce the number of errors we make, help improve the accuracy of diagnoses, help physicians keep even more in touch with the latest literature, and just improve care from beginning to end. So I think not only on the physician side, but the patient side. Um, in terms of research, I think it will speed up research. I think it will speed up drug development. I think we'll have more breakthroughs. And I'm not so sure about, there's claims from the at least OpenAI about ChatGPT producing new science or making new scientific breakthroughs, and the belief that maybe it'll do it within the next year. I'm not so sure about that, maybe minor breakthroughs, but I think people underestimate how much of medicine we don't know yet, how much is still undiscovered, how much about even the intricacies of physiology and neuroscience is unknown. To think that AI is just going to all of a sudden fix that. It's not. We're still going to need the basic science. We're still going to need the research. We're still going to need all of these things to happen. It will enhance the process, it will support it, but it's not going to be a magic fix. I think anytime there's a great new technology, there's always excess hype. I think that's true of AI today. And it can be true that something is excessively hyped and incredibly useful at the same time. So I think that's where we are with AI.
I love your closing remarks there, and I'm really looking forward to your personally signed book that comes out, and I'll be definitely the first person to pick that up. And
Absolutely.
thank you very much, Bhargav. It was a fun session, and I think we have definitely got some great insights about how AI can be useful as a tool to enhance the health care that's being provided today. We definitely have a lot of milestones to achieve, even though we are talking about technology being an added feature to help. We still need to bring in a lot of equanimity in healthcare, providing healthcare for everybody at a position where health can probably be free or no cost to anybody, and then that probably is the utopia world that we need to be looking forward to. And pleasure having you here, and we look forward to having you more in our Hikigai studios for more sessions. And thank you very much.
It was a pleasure. Thank you for having me.
Yep.